have a Spanish recording being made of a full translation of this particular translation, this press conference, and always so gracious to join us to be able to speak directly to the Spanish-speaking audience that we have is our City Council member for District 2, Hector Sabito. Hector, thank you again. Would you invite our Spanish speakers to watch this afternoon at 4:30?
Thank you, Larry, so much. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante la conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again.
Thank you so much. And we do have a lot of people do watch, and we hear that comment. Appreciate that so much. Joining me today for our panel is our Waco Mayor, Kyle Deaver, who hosts this and puts most of the questions in an order that we feel like we can deal with them. We also have McLennan County Judge Scott Felton, Dr. Jackson Griggs, who is the CEO of the Family Health Center, and Dr. Brian Becker, Chief Medical Officer for Ascension Providence. Gentlemen, we appreciate your taking the time. We'll follow the same procedure that we'll do. We'll open our press conference with opening remarks from each of you. We'll hear from Dr. Griggs, then Dr. Becker, Judge Felton, and then the mayor. Following that, I'll read the questions and present that to the panel based on what we've received this week. And then following that, we have two representatives from local media waiting in the Zoom meeting for us, and they'll be able to ask two questions each, and then we'll close with closing comments. So we'll try to get through in about an hour or so. So let's start with opening comments, and we'll start with Dr. Jackson Griggs.
Thank you, Larry. And the sound on my end is a little glitchy, so if you're having difficulty hearing me, just let me know and I can log out and log back in. As has been my usual fashion in the past, I'll start with global numbers, then discuss state numbers and local numbers. Worldwide, we're just about 24 million cases of the novel coronavirus and over 820,000 deaths to date. In the United States, we've had 5.8 million cases and 179,000 deaths, making this the number 3 cause of death in the United States right now, right after heart disease and cancer and right before accidents. The United States is now averaging fewer than 1,000 deaths per day for the first time in a month. So a little bit of good news there. Shifting to the state numbers, the Texas Department of State Health Services reports that there have been 587,000 cases in Texas and 11,576 fatalities in our state. The state daily new cases have been trending downward now for 6 weeks, and daily fatality rate has been trending down for 5 weeks. The rolling average positivity rate in Texas had a peak 2 weeks ago at 20%, then came down fairly quickly to 12%, and now has had a little bump up to 13%. So positivity rate in Texas at 13% right now. In McLennan County, this is the update as of this afternoon. The total number of confirmed cases is 6,008. 1,861 of those cases are active. As of this afternoon, the Public Health District has received notification of 101 new cases of coronavirus. 55 people are currently hospitalized with COVID-19. 19% of those hospitalized with COVID-19 are currently receiving ventilator support. There have been a total of 81 deaths as of yesterday afternoon in McLennan County associated with COVID-19. The total tests completed in McLennan County are 52,000. 85% of those have been performed on McLennan County residents. And our county's rolling average new case rate is right about 15 per 100,000 population. So the average new case rate is something that I haven't shared before, but it's I think that it's an important factor that we should probably be tracking. So I'll be mentioning that on a regular basis. Our new case rate is around 15 per 100,000 population right now, enrolling average. Our positivity rate climbed in the past week from 9 to 12%. So we were seeing a steady downward trend in our positivity rate, and have just seen a little uptick in our positivity rate. And as you recall me mentioning just a moment ago, this corresponds with the state having a little bump in its positivity rate as well. Our effective reproductive number, that's the RT, the UT School of Public Health, indicates that McLennan County's RT has, with only 2 days of exception, been below 1.0 since July 10th. But over the past 2 weeks, McLennan County's RT has been climbing and is now 1.06, which again might be an early warning sign. Within our elder care facilities in McLennan County, currently there are 9 ongoing facility outbreaks, defined as 1 or more residents who have the diagnosis of COVID-19. There have been a total of 460 nursing home associated cases and 37 deaths. At the county jail, there are 24 total active cases among staff and inmates. There have been 2 church clusters within McLennan County. 6 independent school districts and 1 private school have reported cases, but in each of these instances, it's only been 1 or 2 individuals who have been positive. So my synopsis of these findings are that while we've been on a trajectory of improvement for almost 2 months, we've gotten close, but never fully achieved sustained level of adequate testing for our degree of community spread. And now we're seeing some subtle signs that things may be starting to move in the wrong direction. It's too early to make any confident statements, but we need to be certain that we're all getting tested whenever we have even mild symptoms. And that, of course, we're all rigorously practicing masking, distancing, and avoiding crowded indoor spaces. And a particular word for those who attend church in our community, please be conscientious about your health behavior when you're with your church family. And if you're a decision maker at any of our local churches, just please remember that your protocols and your conscientiousness about following best practices are ways to love the community and an opportunity to show God's care for the most vulnerable among us.
Thank you, Dr. Griggs. And by the way, your sound and everything is fine, so if it's on your end, we're doing good here. Okay, Dr. Brian Becker from Ascension Providence.
Thank you, Larry. I'll speak for us. So Ascension Providence continues to see a decrease in the number of patients that we have hospitalized for COVID-19 infections. We've seen a slow but steady decline in hospitalized patients over the last couple of weeks now. Our positivity rate has also shown a bit of a decline for those patients being tested in our clinic system and for those who are presenting to our emergency department. I would like to point out we continue to see an alarming trend with patients delaying care and treatment for serious medical conditions. There have been some studies recently released that show a 66% decline in hemoglobin A1C as an example. It's a tool used to follow patients with diabetes. There's also been a 50% drop in the detection of colorectal cancers and a 46% decrease in overall new cancer diagnoses over the last 4 to 5 months. So I think those are indicators that people are reluctant to come in and get care, to follow up for those chronic conditions that they generally are seen for. We are following recommended guidelines to ensure the safety of patients in our facilities with enhanced sanitization and cleaning, mandatory masking, social distancing, and limiting visitors to one per patient. And we encourage everyone to seek timely care when appropriate and have confidence that measures are in place to mitigate the spread of coronavirus. Now is not the time to become complacent, but we should not ignore our general well-being. So again, thank you for having me here today. I look forward to the questions.
Okay. McLennan County Judge Scott Felton. Judge?
Good afternoon. Well, we still haven't woke up from this bad dream of the COVID-19, and it just seems like it's so hard to get back to doing routine things like we do in running our businesses, and like many of you are trying to do as well. I do know that a lot of businesses that have a lot of walk-in customers are really working hard to try to make that a safe place for the people that trade with them. And I want to compliment them on doing that. As I've said before, it's kind of your decision to do business with businesses that will take care of you when you come in there, wearing masks and handling things properly and all those. We've had a little bit of break in the school season, but now it's all starting back. And so schools have had an opportunity to learn how to teach differently, to work around this, but also have backup plans on a daily basis, and as well as communicating with the students and the parents is a new challenge for them that is something that's pretty significant and important that they do. I think this community will do well in the long run, as we at some point in time when we look back, but we can't let up from a standpoint of making sure that we can do everything that we can possibly to keep our numbers in good shape. Thank you.
All right, Mayor Deaver.
Good afternoon, everyone. Thank you for joining us. I want to again thank the panelists that have joined to help get out the information about where we are in our continued fight against the spread of COVID-19. I want to get into my normal slides here real quickly. This slide shows the cumulative number of cases we've had in McLennan County so far. We are approaching 6,000, but we are still climbing at a much slower rate than we were several weeks ago. So that is a good thing. We've had estimate of about 4,000 of those people have recovered, and just under 2,000 active cases at this point. The next slide shows our new cases since June 1st. I'll just remind you that we were in really, really good shape all the way through the beginning of June. And then about the second week in June, we started seeing this tremendous exponential growth. Since about the second week in July, though, we have slowed this down, and we've gotten down to a more normal rate of growth. The last week or so, we're starting to see a little bit of a bump up, and I'm concerned about that. We'll talk about that a little bit more later. Our hospitalization continues to decline. We had one day this past week where we got up above 60 again, which was kind of a strange day. I'm not sure why that happened, but the thing that concerns me more is that our people on ventilators, patients on ventilators, which is the orange line below, continues to increase. And so even though our number of cases is going down, our sickest patients continue to rise in the hospitals. We had our high mark or low mark, depending on how you look at it. It certainly is not a good thing, of fatalities the week of August 2nd through 9th. We had 16 fatalities that week. The week after that, we had 8 fatalities and then 7 fatalities this past week. We hope that will continue to decline, but the number of patients on ventilators continues to give us concern about that. This is the positive rate for the state on a rolling 7-day average. I added some color this time because I think it's important that we remember that anything above 10% is definitely in the red zone. We'd like to be below that 5% line, and the state has been above the 10% line since the late part of June. It has moved down significantly in July, and then went back up in August. Now we're back in around the 14% range, and hoping for that to go down. We'll talk about some of the factors that could affect that later. This is just looking at the last since the beginning of June, so you can see it in a little more detail. On a shorter timeline, you can see a little bit more of what's happening. For McLennan County, we actually exceeded the state's positivity rate in July and got up to as high as 23%. We are now slightly below the state's positivity rate at just about 12%, where the state was at 13 on a 7-day average. Again, this next slide takes that from June 1st so that it's a little more expanded and you can see better what's happening with the numbers. We do see that uptick in positivity rate over the last week, and we're concerned about that. That's all I've got for slides. I want to say that as Judge Felton said, our community has really done generally a very good job over the last couple of months following the physical distancing guidelines and mask orders, and it has worked. I want to thank each of you for doing your part to help us slow the spread of the virus. We have significantly reduced the number of new cases and the positivity rate in our community. We have several challenges in front of us now and in the coming weeks, and I want to talk about that just a little bit. First, our colleges are opening and students are returning to Waco. They have returned to Waco. This is a good thing. We want to welcome them back. We need them here in Waco. We need them both for our economy and for the vitality that they bring to our community. But we are going to both need and expect them to follow the orders and the guidelines as they live in our community. Baylor and MCC started Monday for their fall session. TSTC has been in session through the summer, largely virtually. They start their fall semester next Monday. Baylor tested all of its students and faculty before they returned to campus, which was a really great proactive move, which I appreciate, and I know you all appreciate them doing that before they brought particularly all the out-of-town students back to Waco. Despite this precaution, Baylor's health clinic tested 89 positive cases in the first 2 days of class. So it is going to be a challenge. Baylor knows it's going to be a challenge. They are working with us closely and communicating as well as can be expected. They are doing a great job, being very proactive. Baylor has stood up a dashboard of its own where you can see what's happening with their students with regard to coronavirus. You can find that on the covidwaco.com website, and I encourage you to look at that. Baylor plans to test 10% of its students every week for surveillance testing so they can know better what's happening with their students. The greatest concern is not on campus. I drove through campus yesterday at Baylor. Virtually everyone I saw had a mask on and was wearing it properly. I was extremely impressed, and they are going to great lengths to try to make that happen. The biggest issue is social gatherings off campus, and that's true for Baylor and MCC and TSTC, and it will be true for our high schools as well. That's where we've got to ask people to be respectful of the rules and the orders that are in place. Otherwise, we're going to start seeing shutdowns of in-person class, and nobody wants to see that. So that's the first big factor. The second one is Hurricane Laura. It's about to impact the Gulf Coast, and we have a number of people who have come to Waco to escape the storm. We certainly want to welcome them as they're staying in our hotels and our, in friends' houses and short-term rentals. The good thing is that most of these people have come from Texas, so they know what the rules are across the state. We need them to abide by those rules and keep Waco safe as we try to keep them safe from the storm. Obviously, Labor Day weekend is coming up. That is always, these big holidays are always a challenge as far as trying to help people understand that they can't gather the way that they normally would. Churches are opening up more and more. Dr. Griggs mentioned that. I understand everybody wanting to worship together. That is a normal thing. but we must ask you to please follow the best practices and guidelines, even though you're not required to do that by law in church. As Dr. Griggs so well said, this is a way of showing your love for the most vulnerable citizens in our community, and we need you to do that. And then finally, bars. Yesterday, the Texas Alcoholic Beverage Commission, the TABC, announced significant changes to their permitting process so that bars can more easily reopen as restaurants under a food and beverage permit. You know, this is very good news for the bar owners and for their employees. Bars have been closed now for many weeks under the governor's orders. But this also represents a huge risk for our community. And the bars that open under these permits must do so in accordance with the state's guidelines for restaurants. That means they can't exceed 50% capacity, and they have to have 6 feet between tables and between people that are at a bar. Waco will continue to enforce those rules as we have with restaurants throughout this pandemic, and we ask that the bar owners work with us to try to minimize the negative impact that this has and hopefully allow them to not be closed again by the governor. That's all I have for now, and I look forward to the questions. Thank you.
All right. Thank you all. Let's jump right in on the questions. The first question we actually have is kind of what you mentioned, Mayor. We're seeing an increase in people from Houston in the area due to Hurricane Laura. What are Waco and McLennan County doing to keep COVID numbers down?
Well, as I said, I mean, we definitely want to welcome these people. They are running from a dangerous storm, and we want to welcome them to our community. We have several communication campaigns that are in place that encourage healthy behavior, including masks and hygiene practices and distancing practices. These include the Cover Your Face, Protect Your Space campaign, as well as the Mask Up, hashtag Waco Safe banners on lampposts downtown. And we're going to continue to work with the CVB and our hotel association to be sure that the people that are checking in understand what we need them to do as we try to protect them from the storm.
Okay. The Houston Chronicle reported that the state testing data and positivity rate is fluctuating and unreliable. In some cases, data hasn't been entered for months. Is the local rate more or less reliable, and why?
Dr. Griggs, would you speak to that, please?
Yes, the positivity rate that's calculated by the health district for McLennan County uses testing data derived from the local health partners. So Family Health Center, Ascension Providence, Baylor, Scott and White, Hillcrest, and others contribute. And the health district's been receiving that data since March, and it's the best representation available of our positivity rate. I trust it. I use it for decision making. I think it's important to note that that we're not talking about a machine or a computer program, but we're talking about an ecosystem here. And so at any given time, there might be, for any of a variety of reasons, a few tests that are delayed or a few tests that might even be entered preliminarily incorrectly and might have to go back and be revised. But the trend and within a there's an adequate margin of error for me to feel very I feel trust in the numbers, and I don't worry about them being inaccurate. And I've seen that whenever there is an outlier, the health district goes back and is double checking that data and confirming that it's accurate. So I think the systems in place are good systems. The health district's doing a good job of keeping those numbers accurate. And I'm sure, as this audience knows, that data is available at covidwaco.com. If you want to really drill down, you can download the Excel spreadsheet and look at the numbers date by date.
Okay, will the health district alert the public about outbreaks at local schools and higher ed institutions?
Larry, the health district will closely monitor outbreaks at local schools and higher ed institutions. If there is an outbreak, the health district will work hand in hand with those facilities, whether it's a local school or school district or a higher ed facility to release the information to the public when necessary. There's always the question of, is there a public health interest in knowing, and that's the part that they need to work through with those institutions. We'll work, our staff, the health district staff, will work with each of these institutions in that matter.
Okay. How many of the county's cases have been healthcare workers so far?
Dr. Griggs, I know that that's not a statistic that the health district keeps. Can you speak to that a little bit, please?
Yes, so there's not a reporting system for those numbers, but in conversations with our local healthcare leaders, the number of staff in our healthcare systems who have tested positive at any point since the beginning of the pandemic is well below 5%. And importantly, with only a few exceptions, the virus in these cases has been acquired in community settings and not within healthcare settings. What I've seen from Ascension Providence, Baylor, Scott and White Hillcrest, and of course what we've done at Family Health Center, all three systems have rigorous protocols in place to protect our healthcare workers. We know how important our healthcare workers are, not just to us, but to our entire community, and keeping them safe is critical. Recently, there was a JAMA publication that looked at asymptomatic occurrence of coronavirus among healthcare workers. The data was derived in Houston from clinicians who were on the front lines during March and April, and so we're talking about asymptomatic healthcare workers here. And among those in COVID units, only 5.4% of those asymptomatic healthcare workers carried the virus, and 0.6% of healthcare workers in non-COVID units tested positive. So given that now, several months later, we're all wearing N95 masks virtually universally among all of our clinicians who are providing patient care, the likelihood of transmission to patients is estimated to be very low.
Okay. Why has the release of nursing home data been delayed, and what format will the data be presented in when it is available?
Larry, there was some discrepancy between the way that the health district was reporting numbers of cases in long-term care facilities and the way that the long-term care facilities were reporting them, and we've tried to work that out to be consistent. The Department of State Health Services says that an outbreak is present in a long-term care facility whenever you have even one case within that facility. And it doesn't matter whether that case was acquired within the nursing home facility or whether it is a person who works at the nursing home facility that is, that acquires it somewhere else. And so we are going to be posting beginning today on a weekly basis the number of the name of each nursing home that has any outbreak and the number of cases that we have had reported to us from those nursing homes. That will be updated weekly, and hopefully that will solve that problem going forward.
Okay. With Baylor students now in town, how are they being isolated if they test positive? And do we expect any change in the number of cases because of their desire to mingle?
Dr. Griggs, I know you and I both heard and judged it too this morning from Dr. Livingstone on this. Would you be willing to talk about that a little bit?
Absolutely. And preliminarily, let me just say that Baylor University, MCC, TSTC, all of our institutions of higher education have been really in a challenging time of economic hardship and stretched resources, have done a really exceptional job of trying to limit the spread of the virus, and have made preparations for return of students. So I, like you've heard the mayor already mention, I just echo his affirmation of the strong work at Baylor, in particular right now, the work that they've done as they've seen the biggest surge of return of students. When Baylor has a student who is living on campus who tests positive, they've set aside isolation beds, and that student is able to stay on campus and live on campus in an isolation bed until they're no longer infectious. If students live off campus and they're positive, they're given very strict instructions on isolation and are monitored. So a good system in place for providing students that live on campus beds so that they can stay on campus and stay isolated. And like with the easing of economic restrictions in May and with public schools opening this month in September, to answer the question, yes, I do see some impact because of student behavior. I do expect it to have some community impact, but saying that, based on Baylor's protocols, I can't imagine a university doing a better job to prepare for on-campus education during a pandemic.
What should we do if a school is not following social distancing guidelines?
Judge Felton, would you speak to that, please?
Sure. Well, I think the schools are taking this very seriously, and they're going to make every effort to follow those guidelines. But if you are concerned or have information that leads you to believe that maybe they aren't practicing all the social distancing and other protocols, then I would recommend you call the principal or the superintendent and talk to them about that. Many of these schools will have a lot of information on their websites about what they are going to try to do, and so that would be something you could ask them about if they're actually following those. Additionally, if you do not feel that you were properly, your question was properly answered, the agency that's the regulatory authority is the Texas Education Agency. And they have a phone number of 512-463-3544. Or you can contact them at complaintsmanagement@tea.texas.gov.
Okay. How will we be notified if a school or college has positive cases?
Larry, my understanding is that the TEA requires any school to notify the parents of children in that school if there's a positive case on that school's campus where their child attends classes. Several schools may be updating their numbers of positive cases on their websites. Additionally, the state has announced that they will be releasing the numbers on the TEA's website as well. Similarly, colleges may be releasing the number of positive cases on their campus as well. Baylor, as I mentioned earlier, has set up a really good dashboard where the public can see their numbers on a real-time basis. And to access that, just go to covidwaco.com and click on dashboards, and you can see the Baylor dashboard is one of the options there.
Okay. Are positive cases from Baylor counted in the daily case counts for us in McLennan County?
Dr. Griggs, can you speak to that, please?
Yes, they are, except for the students who tested positive from home outside of McLennan County and have not yet arrived to Waco.
Okay. Several orders from the governor and health districts cited Labor Day as a key date. What changes, if any, from existing orders will occur after Labor Day, and will Waco McLennan County's orders remain or be extended?
Judge Felton, I'll let you speak to it from a county perspective first, and then I may have one or two things.
Okay. Well, of course, the governor calls those shots, and so don't really know if he's changing the criteria that he's looking at to determine the order at this time. But of course, we will have to modify our orders or extend our orders at that time as well. But the governor chose to be the the conductor of this train, so we're just kind of following along. Mayor?
Yeah, I agree with that, Judge. I mean, I do think that the mask orders across the state have demonstrated themselves, and across the nation and the world have proven to be effective, and I would expect those to continue unless we are prohibited to do that by the governor.
Okay, is the Waco Convention Center able to book meetings or conventions for the future? And if not, what criteria or change in orders are we watching or waiting for in order to do so?
Larry, the Waco Convention Center is able to book events at 50% capacity or less, as long as the 6-foot physical distancing can be maintained in each room that is trying to be booked, following the governor's Reopen Texas orders. However, each request that we receive is being reviewed carefully in partnership with the Waco and McLennan County Public Health District to be sure that that can safely be conducted. And so far, the only things that we have approved and are booked are appraisal review board meetings and a vote center for the November general election.
Okay. How is the Small Business Recovery Fund program that the city and county made available working? And are there funds still available? And can you give any examples of how these have helped?
Judge
Yes,
Phillips, go ahead.
Yeah. Well, so far the program's been very successful. The Small Business Recovery Plan offers grants up to $5,000 for small businesses, and so far there's been 203 business loans made in this program. The city and the counties put in about $207,500 into the program, and that will be utilized with already an existing community development business grant that the city has, which is came from federal sources, to be utilized in our local community. The expenses that can be covered include leases and mortgages, operating expenses, as well as payroll. So we feel like this will help bridge this financial gap that many of these small businesses have.
Okay. There was an article in the paper Tuesday that mentioned that the backlog of jury trials in the county and how the grand jury continued to indict persons for trials. What's the latest on pending trials?
We're waiting right now for the Office of Court Administration to give us further instructions. We were instructed earlier not to have any trials before October 1st. In fact, today, I think there's a meeting that with some of the judges, along with the Texas Supreme Court judge that is in charge of these guidelines. And it's my understanding that after October 1st, there'll be some limited amount of trials that can take place, and they're wanting us to kind of ease into it to be sure that we can handle it. There's a lot of things to take in consideration in putting these together. The jury call generally is quite big, from we've had as many as from 300 to 500, and so probably be starting with a lower number, maybe meet at a place such as the convention center or other large meeting places, to be able to assign those people to different courts. And so we're looking forward to getting that done. That we do have a huge backlog, and it's going to take years for us to catch back up.
Okay, here's one for Dr. Griggs and Dr. Becker. Given what you know about the need to slow the spread of coronavirus, balancing against the competing needs to have children back in school under whatever conditions, all the different protocols and spread and positivity rates, would you be comfortable allowing your children to attend school in person? And at what point would you be willing to allow them to ride a school bus?
Well, I'll give this a first try here, and then let Dr. Becker follow up. So there are multiple factors that play into a decision like this. I wish I could come up with a pithy memorable formula for all parents, but there isn't one, and I want to be careful not to give a one-size-fits-all answer. The CDC offers a resource for decision-making, and so I might start by recommending that to parents. It's called a School Decision-Making Tool for Parents, Caregivers, and Guardians. So the CDC, if you Google search or however you want to find it, School Decision-Making Tool for Parents, Caregivers, and Guardians. But let me share with you the process that I might suggest, just the step-by-step way in which you might consider thinking about this decision. The first question I might ask is whether my child or someone in the family is particularly susceptible to coronavirus. My child or someone in the household is particularly susceptible to coronavirus. If I had a child with cerebral palsy or uncorrected congenital heart disease or uncontrolled asthma or diabetes, I might be more reluctant for them to attend in-person school. And likewise, if the primary caregiver or other household member are an aging adult, particularly someone over 65 years old or an individual with a major medical condition, I might similarly be cautious about in-person schooling. Assuming none of those factors apply, I would next consider the myriad of challenges that might play into a family decision on the matter. Things like access to the school meal program or social services or special education, extended daycare for working parents and guardians, and other services provided by the school that may be essential for specific families. There's no two families look identical, and every family is going to have their unique circumstances and needs. And so heeding what services the school offers is an important part of the decision making. In households where there are no health vulnerable members and there are ample resources for children to continue distance learning, families really have an opportunity to limit childhood spread of virus in the community. This holds true especially in children who are greater than 10 years old, who may spread the virus at higher rates than younger children. So especially in that population, if ample resources exist for families, I might recommend at least the consideration for distance learning until our rolling average in our community is below 10 per 100,000 new cases, and our positivity rate is consistently less than 10% and ideally less than 5%. This would be consistent with the Harvard Global Health Institute's recommendation in a document entitled The Path to Zero and Schools. And finally, a quick answer regarding bus travel for children. Again, when needed, children should use bus transportation, but kids really have to be trained on physical distancing on the bus, prioritizing seats by the window, outdoor, a lot of outdoor air in the bus, consistent use of masks, frequent use of hand sanitizer, and the critical importance of following the bus driver's instructions at all times.
Dr. Becker?
Jackson didn't leave much meat on that bone. He answered it pretty well. I would agree almost with everything Jackson just said across the board. So I believe it's very much an individual decision. And it is based on the health of the student and the health of others in the household that those students may in turn come in contact with. And it's not an uncommon that the crux of this question is what would Dr. Griggs and I do with our family? I have two children who are students in two different Big 12 universities, and I've delivered both of them to college. So they are in school. I think it's critical that we remember what Jackson pointed out, that social distancing, use of masks, hand hygiene can't be stressed enough. And I think that's a constant message that should be given to our children, that they observe those, that they make sure that the friends that they associate with do as well, and not be afraid to point out when there's a failure to do so. So I think it's, again, an individual choice. Dr. Griggs gave a number of really good resources for families to weigh that choice and make a wise decision.
Okay. We're going to wrap up our questions here. Now we're going to go to our media contacts. We have two representatives on the Zoom call with us, Drake Lawson from KWTX News 10, and we also have Rhiannon Sagert from the Waco Tribune-Herald. So let's start with Drake. Drake, are you on the line, and what is your first question?
Yeah, Larry, can you hear me okay?
Hear you fine.
Okay, perfect. Just want to make sure. My question is about something that Mayor Deaver has hit home on plenty, but just to maybe get another comment about it. Everybody's talking about the fact that Baylor students are back on campus, and you touched on it, Mayor Deaver, 89 cases in the last 2 days since classes really began. At other schools, University of North Carolina, Chapel Hill comes to mind. When they had 130 new cases, that's when they called off in-person instruction. I know they have a lot of plans. I know they're doing a lot of things. I went out to the campus today. They're all wearing masks. Is there anything that they can do, or is this going to be inevitable that we're going to have to shut it down? Well, what is your opinions as students head back and COVID-19 numbers continue to rise like this?
Well, I'm not sure I'm qualified to say at what point they should shut it down or whether they will have to. I will say that obviously those 89 cases that were diagnosed Monday and Tuesday were acquired before these students came to Baylor. They wouldn't already be testing positive in just 2 days of classes. Some of them moved in over the course of the last week or so. In addition to the isolation and quarantine measures that Baylor's put in place, they are also doing contact tracing. I think they're doing their own contact tracing in addition to any contact tracing that the health district and DSHS may be doing, and they are coordinating with our health district on that. So they are taking all the appropriate measures. I certainly hope that they don't have to shut in-person class down, but we're all on an uncertain path here, and I don't know exactly what their metrics are for when they would decide that, if they have to. But we are in constant communication with them. They have been completely open with us about what they're doing and what precautions they've taken. So I think we're just going to have to wait and see and hope for the best, and also ask those students to refrain from having parties on the with their buddies outside, in the neighborhoods. And I say outside, I mean outside the campus. With bars opening, that is going to create a whole new challenge. Again, I understand that bars want to open. They need to open for their business to be able to keep from failing. And all of these things are just matters that we have to balance, and we have to be smart about them. And Jackson's words about churches are another big concern with the Baylor students, because we know that many of them attend churches, many of them attend some of our largest churches, and we just need them to be careful as they do that.
Okay, Rhiannon Sagert with Waco Tribune-Herald. Rhiannon, are you on the line?
Yes, can you hear me?
Yes. Go ahead.
Right. I had a question about the rolling average of new cases. Why is that now important to look at?
Dr. Griggs, will you speak to that?
Yeah, thank you, Rhiannon, for the question. And it, we're learning as we go, and we've been talking a lot about positivity rate, but incidence data and how we look at incidence data and how we norm that incidence data so that we can compare apples to apples when we're looking at populations is valuable as we begin to use incidence data for decision making. And I think we're learning now enough about thresholds and risks to begin to say, okay, when the incidence data in a population that has 1 million was at a certain threshold, we begin to see this kind of outcome versus, and how do we apply that to then a population that only, like McLennan County only has 256,000. So we don't, if we're comparing raw numbers of incidents in one area versus the other, just actual cases, new cases, then we're comparing apples and oranges. We have to norm it in some way, or create a ratio that's the same ratio for all communities. So as more information comes out, as that information becomes increasingly actionable, we need a ratio that we can compare across communities. And so that's why that ratio feels valuable, and I'm seeing it just crop up more and more in epidemiologic literature. Like I said, I'll try to report on that on a regular basis.
Okay, Drake Lawson, you have another question for us?
Yeah, just one other question, and I don't know who's best to answer this. Maybe Dr. Griggs and maybe Mayor Deaver. Just as you mentioned, Mayor Deaver, a variety of things happening with bars and people coming in from Houston for the hurricane, and with students going back. Should we expect, should people not be shocked to see numbers go up in the next week or so, or next 2 weeks, just because of this increase of population?
Yeah, I mean, certainly we know that we've just brought 15,000 plus Baylor students back to campus. Some of those live in Waco and McLennan County, but the majority of them do not. So you've already increased the population there, and now you're increasing others. So you've got to see more cases. But I'd like to ask Dr. Griggs and maybe Dr. Becker to expand on that, please.
Dr. Becker, do you want to go first?
Sure, and this is again an opinion. So I think it's hard to bring students back into a social environment like a university setting, or to have people traveling in from other places across the state, whether it's a hurricane that's driving them here or an event that's here. I think all of those introduce a new person into our community who is potentially or was potentially exposed in the community from which they came. So I think there's always a risk with that. I would not be surprised to see some increase in our case volume. I'm hopeful that while we may increase our positive testing rate, I'm hopeful that we don't see an increase in our need for hospitalizations or critically ill folks across our community. But I do believe we will see an increase in positive testing.
I agree, and I don't have anything more to add.
Okay.
Thank you.
Rihanna, do you have a final question for us?
Yes. Again, it's about the people here from the people fleeing Hurricane Laura. Is there an estimate of how many people are here from that area, or are you using hotel capacity sort of as a guidepost? What would you think?
I don't believe we have any actual estimates of the number of people that are here, but we are hearing that our hotels are reaching capacity. So I think that indicates that we're getting a fair number of people here, and I don't know how many thousand that is, but I would guess that it is in the low thousands.
Okay, thank you all for that. All right, let's begin our wrap-up session. This is try to always end within about an hour or so. I'd like to have final comments from each of our panelists. We'll start with Dr. Becker, then we'll go to Dr. Griggs, Judge Felton, then wrap up with Mayor. So Dr. Brian Becker from Ascension Providence.
Thank you, Larry. And again, I'd like to thank Mayor Deaver and Judge Felton, the team, both in the city and county, for asking me to participate again today. I think it's important for us to constantly keep that drumbeat going on social distancing, mask, hand hygiene. We simply can't say that enough, and we can't stress that enough. It is something that we can all participate in as we try to mitigate the risk. Flu vaccines coming up. We are starting to see deliveries of flu vaccinations across our community in the healthcare settings. And as they become available, I encourage members of our community to become vaccinated, to get their vaccines for flu prevention. And as I started this conversation, I think it's critically important that members of our community not delay medical care to manage chronic illnesses or acute changes in your health. It is vitally important that you seek out care from your provider to address those needs as they arise. So again, thank you for having me here today.
Dr. Jackson Griggs from Family Health Center.
I had a note to myself to make sure and mention the flu vaccine, and Dr. Becker beat me to the punch. So I'll just reinforce that point. The flu vaccine this year is particularly important. The Family Health Center, we don't have our supply yet, but it's becoming available in the community. There is no reason to delay. The Advisory Committee on Immunization Practices out of the CDC says to wait until September, but make sure and have it be vaccinated by the end of October. But we're 6 days away and we're in the midst of a pandemic. So my inclination is that we have the green light to move forward and get your vaccination, your flu vaccine, if you can get access to it. Now's the time. So start looking for it, get vaccinated any way you can. We'll at Family Health Center, we're expecting our shipment from the state supply usually comes mid-September. They may bump up that time frame a little bit this year, but I will make sure and mention it in this venue, and we'll be sharing it with our patients as soon as we get access to that. Let me share with you, though, something that I'm particularly concerned about right now. There were experts in mental health who were warning us about a coming wave of mental health crisis in America. We've seen the first of what I think will be many studies that are describing the change in incidence of mental health conditions. This came last week out of Morbidity Mortality Weekly Review. Which is publication of the CDC. It looked at cross-sectional data, so survey of folks across the United States. And it showed that the survey revealed that 41% of those responding to the survey indicated at least one adverse mental or behavioral health condition. Depression and anxiety, symptoms of trauma, substance abuse, and suicidal thoughts were all alarmingly high in the survey results. There are resources that are available. If you are someone who is struggling, please reach out. Tell a trusted friend that you need help. If you have the courage and if you're willing, then make the call yourself. There's an MHMR crisis line. They can redirect you to resources. I'll share with you that number. That number is area code 866-752-3451, 866-752-3451. All three of the major primary care healthcare systems in our community, Ascension, Baylor, Scott and White, Family Health Center, also have clinicians who are eager to see you and take care of mental health needs. Our new patient hotline, if you don't have an established primary care provider, you can call our new patient hotline. That's 254-313-4610, and we can get you in very quickly. There is a long history of stigma associated with the mental health conditions, but thankfully, I think our community in Waco and our society across the United States is getting sophisticated enough to understand that this isn't a fault issue, that mental health conditions are real and impact any one of us and are very, very common. So Please dig deep, reach out to someone, call the hotline, get help if you're struggling with a mental health problem right now. And if you're not sure, get help and have a conversation with a clinician, and they can help sort things out for you. And that's all I have.
Okay. McLennan County Judge Scott Felton. Judge?
Well, thanks, folks, for spending time with us today. When we look at these situations, we do know that they could be worse. One of them could be that our economy was totally cratered. And although there's been some damage done, overall, we're in pretty good shape financially in our community. I will say that we are struggling trying to access CARES Act money to get those placed into the hands of our local people here due to some restrictions that the state has in accessing those dollars. But I can tell you that between the city and the county and the other cities in our county, we're working hard to get those. And last week, talking to Senator Cornyn, that the new tranche of funding that's to come out will be less restrictive and we should be able to access better. And we're going to try in every way to get those dollars into our community. And we think that that's our job. So we're going to do that. Otherwise, we are blessed here in this community to have a growing economy. We have new constructions doing very, very well. Surprisingly, sales tax has picked up back up, and I think a lot of that's due to online business is pretty good, where we're allowed to have access to some of those tax revenues from that. One other thing, just to point out, most people don't know that our economy is made up of 6 industries that are over 10% of the economy, and where most counties are very glad to be at 4 or 5 in that area. So we're going to continue to work on that. Economic development efforts are strong, and I think you'll see before this year's out some pretty significant announcements that hopefully will keep us moving forward, and our unemployment rate should be one of the lowest ones in the state. Thank you.
Okay, and Waco Mayor Kyle Deaver.
Thank you, Larry. I, as always, want to thank you and your municipal information team and Julie Olvera with the City Secretary's office and the City Secretary's team, and Kelly Crane and all the great people at the Waco McLennan County Health District for your help in putting these press conferences together, and also all the hard work that you're doing outside of these press conferences to try to keep our community safe and slow the spread of COVID-19. Thanks to all of you, Dr. Becker, Dr. Griggs, and Judge Felton for joining us again here today. So important that we keep informing our citizens about what's going on here, what they need to be concerned about, what they can be proud of. And Judge, you're right. I mean, I think we are very, very fortunate to have such a diverse economy in Waco, and we continue to do better than expected through a very tough time. That's not to say that many businesses are not struggling, and we need to continue to shop local, as Judge Felton reminds us almost every week, and do what we can to support our local businesses. But our economy overall is doing surprisingly well, and that's good news. I also want to touch on what Dr. Griggs said regarding mental health. I think that is so important, and it sort of goes along with several other things that we've talked about over the weeks. Texans seem to have an aversion to things like seeking help for mental health. We tend to think we're tough enough that we don't need to deal with that. And the reality is, it is an illness just like any other illness, and really urge you, if you're having any trouble at all, to reach out to a therapist. We've got a great community of mental health and behavioral health therapists here in Waco, and they can help you figure out whether you need to be doing something differently and how they can help you. We discussed the current and upcoming challenges that we have here in our community, things like schools reopening, the hurricane, and all the people that are coming here to escape that. The only way that we can can get through this successfully is to continue to be vigilant in the days and weeks ahead. We must continue to stay home when we can, maintain 6 feet of physical distance from those who are not in your household, and we must continue to wear masks when we're in public and we can't maintain that distance. I've heard a lot of people talking lately about COVID fatigue, and I think we're all feeling it. We're all tired of this. We want it to go away. We don't have control over that. What we do have control over is our personal response to it, and that's how we keep each other safe and keep our families safe and help our economy continue to reopen. It's the only way that we can get through these challenges without seeing significant increases in new cases and ultimately in deaths. Yesterday, another of our neighbors, a 35-year-old Hispanic woman from our community, died from COVID-19 after several weeks in the hospital. It is my understanding that she did have a pre-existing condition that put her at higher risk of serious illness from COVID-19. But that doesn't diminish the tragedy of a 35-year-old person dying from this disease. She was someone's child. She may have been someone's mother. In any case, she was one of our neighbors. Many of us have pre-existing conditions, and some of us don't know about them. So I just ask that you continue to be vigilant. Please continue to take care of yourself and take care of one another. We are getting through this together. Thank you.
I want to thank all four of you all for always being so detailed information I think this community really needs. And I want to point out the fact that this will immediately be available within probably 30 minutes to an hour. So share it with your family, your friends, co-workers. It will be on our website. You go to our waco-texas.com and right down the list you'll see the latest press conference right there. And as well as the Spanish translation will be airing at this afternoon at 4:30 live and replayed on our website as well. So we're trying to do everything we can to make this information out that these gentlemen have shared their time and energy with too, and we hope that it all makes a difference and we all will get out of this as we will, and we hope that. Thank you all for joining us and have a good afternoon.
There they got a little light again, and it's raining cats and dogs out there. I was skinny then, and I slithered out there like a snake with all that brick and rubble is about 10 feet high. And I got to picking my way around, and I thought, well, I'm not out of the woods yet. I started to go by way of 5th, but the RT Dennis building and the Patchett building were both stacked up in the alley. So I had to go to 4th.